Welcome back, everyone, and we want to welcome Dr. Kumar to the set today. We are here to discuss a recent study that found heart attack symptoms for women are sometimes missed. Good morning, Dr. Kumar. Thanks for joining us. What does this new study say?
So it's out of journal Circulation, which is the publication of the American Heart Association. And this month, of course, Heart Awareness Month, and particularly, you know, honing in on women, particularly with heart disease. And it's long believed that women might have different symptoms of heart attacks than men, that you ought to be aware of different issues with women. But that's not necessarily exactly true. What happens is that both men and women both get chest pain. And that is the major symptom of heart attacks, an elephant or somebody sitting on your chest. And you could have pain going up into your jaw or your left arm. But they did a study, studied 2,000 women and about 800 men. And they looked at women, at both men and women that had been admitted with heart attacks, and then went and surveyed them and said, hey, did you go see your doctor for these symptoms before you showed up to the hospital with a heart attack? And a lot of them did. They had shown up to their doctor with symptoms of chest pain and things like that within a week before they got admitted. Women were more likely than men to report multiple symptoms. It's not only the chest pain that they reported, they also had a little bit of flutter, they might have had a bellyache, they might have had some other kind of symptom. And of the people that were advised to go seek further heart evaluation, only 38% of women were advised to go seek some other testing, whereas about 58% of men were. So, like, with the same symptoms that they went and saw a physician for a week before their heart attacks, women were less likely to be advised to seek further testing. So the take-home point is that women sometimes present with multiple symptoms, and they're particularly, these were, by the way, I should say, between ages 18 and 55, so they're younger women, right, not the people at risk factors. So, but they also get heart disease. The younger women, symptoms of chest pain are more likely to be attributed to something else.
I don't want to point the finger at the doctors, but if you're only sending 38% of women compared to 50-something% of men, how are we supposed to know?
No, I mean, it's a problem for all of us. And, you know, part of the message here is just to healthcare providers as well as the public, that younger women, even less than 55, both younger women and men, are eligible for heart disease. As we just heard, it's the #1 killer in the country. There is a rising epidemic of obesity and high cholesterol and sugary products. And so the risk factors are happening earlier: smoking, diabetes, kidney problems, chronic lung problems. There might be underlying issues that may not be taken into context when looking at a younger woman that has chest pain along with other symptoms. And it is a take-home message for everybody, that particularly for providers, for doctors and urgent care providers, that when somebody presents with chest pain, to take the whole picture into context and to consider very highly that when they present with chest pain, that heart disease is in the differential, and not to ignore it. Because that's the thing that if you ignore, you're going to get into trouble. You know, but if you have a little bit of pleurisy, you know, a little musculoskeletal inflammation that can also cause chest pain, those things aren't going to cause damage. It might be uncomfortable, but they're not going to cause any harm. But missing a heart attack will cause harm. It'll cause death of part of your heart. It can lead to death because of, you know, arrhythmias and things like that. So to put heart disease at very high on the differential when anybody, a man or a woman, presents with chest pain and seeks health care evaluation, that means it's enough to them.
All right.